Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
How are you today, my students?
I'm fine and very happy.
Give applause for us. Okay, my students, before we start our lesson today, let's pray together. My students, I will check your attendance now. Hanif Rabani,
Present, Miss.
good job. Fuad,
I Miss.
good job. Sestiana Sagusti,
Present, Miss.
okay, I have my students who knows what is the problem in the world now. Okay, Fuad, your turn.
The problem is coronavirus disease 19.
Okay, give applause for Fuad. Okay. Okay, good job, Fuad. So, what is the topic now?
The topic is about the news.
Okay, good job, Fuad. Give applause for Fuad. Okay. My students, our topic today is what's the news? So, who can explain about coronavirus disease 19? Okay, Hanif, your turn.
Coronavirus disease 2019, abbreviated as COVID-19, is a respiratory illness that spreads from person to person. It's caused by a new virus that was first detected in China and has now been detected around the world, including the United States, Indonesia, and many more infected countries. The World Health Organization, the U.S. Centers for Disease Control and Prevention, and other public health authorities are still learning about this virus and are working hard to control its spread and make sure our communities are prepared. You can help protect yourself.
Good job, Hanif. Give applause for Hanif. Okay, good. Okay, the other one. Who wants to explain about COVID-19 in front of the class? Okay, Sesti, your turn. Give applause for Sesti.
Coronavirus are a family of hundreds of viruses that can cause fever, respiratory problems, and sometimes gastrointestinal symptoms too. The 2019 novel coronavirus is one of 7 members of this family known to infect humans, and the third in the to pass 3 decades to jump from animals to humans, since emerging in China in December. This new coronavirus has caused a global health emergency.
My students, I have a video for you. So, let's start it.
Coronavirus disease 2019, abbreviated as COVID-19, is a respiratory illness that spreads from person to person. It's caused by a new virus that was first detected in China and has now been detected around the world, including the United States. The World Health Organization, the U.S. Centers for Disease Control and Prevention, and other public health authorities are still learning about this virus and are working hard to control its spread and make sure our communities are prepared. You can help protect yourself and those around you from getting and spreading respiratory illnesses like COVID-19 by taking some simple precautions. One of the most effective ways to prevent the spread of germs is to wash your hands often. Make sure to scrub with soap for at least 20 seconds. If soap and water are not available, use an alcohol-based hand sanitizer that contains at least 60% alcohol. Hand washing isn't the only preventative measure you should take to reduce the spread of germs. It's also important to avoid close contact with people who are sick and keep at least 6 feet between yourself and anyone who is coughing or sneezing. Avoid touching your eyes, nose, and mouth. Cover your cough or sneeze with a tissue, then immediately throw the tissue in the trash. If you don't have a tissue, cough or sneeze into a bent elbow instead. Never cough or sneeze into your hands or into the air. Clean frequently touched objects and surfaces daily, such as tables, countertops, doorknobs, light switches, and cabinet handles with household cleaners and disinfectants. Stay home if you're sick. If you have a fever, cough, and difficulty breathing, seek medical care, but be sure to call in advance. Your medical provider will be able to direct you to the appropriate facility in your area. Lastly, follow the CDC's recommendations for using a face mask. Face masks are not recommended for use by the general public. Rather, face masks should be worn by people who show symptoms of COVID-19 to help prevent spreading the disease to others. Face masks should also be worn by people taking care of someone with COVID-19, such as loved ones or healthcare workers. While there is currently no vaccine to prevent COVID-19, staying up to date on your other vaccinations can help you stay healthy and protected against other respiratory infections, such as a seasonal flu or pneumonia. If you haven't already, ask your healthcare provider about which vaccinations are recommended for you.
My students, who wants to explain how to prevent COVID-19?
When the spread of germs is to wash your hands often make sure to scrub with soap for at least 20. Second, if soap and water are not available, use an alcohol based and sanitizer that contain at least 60% alcohol, and washing isn't the only preventive measure you should take to reduce the spread of germs. It's also important to avoid close contact with people who are sick and keep at least 6 feet between yourself and anyone who is coughing or sneezing.
Students, I have a homework for you. You can open the book, page number 19. Okay. I think that's all for today, and don't forget to say hamdalah.
Alhamdulillahirabbil alamin.
Okay. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
See you next time.